A dry mouth every morning is not just uncomfortable. It is one of the earliest warning signs that your heart, your brain, and your lungs may already be under threat. And most doctors never connect those dots. Stay with me for the next 13 minutes because number one on this list is the one your physician almost certainly has never mentioned. And it may be the most important health conversation you have had all year. You wake up, your mouth feels like sandpaper. Dry, thick, sticky. You reach for water, you drink, you move on. Here is the problem. Millions of people over 50 do exactly that, every single morning, and never once ask why it keeps happening. They assume it is normal. They assume it is age. They assume it is nothing. It is not nothing. What is happening inside your mouth while you sleep? The bacterial explosion, the silent tissue damage, the chain of consequences that moves far beyond your gums and teeth does not pause while you are resting. It accelerates. By the time this video ends, you are going to understand why that sticky morning feeling is one of the most important signals your body sends after 50. And you are going to know exactly what to do about it, starting tonight. My name is Dr. Ethan Reed. I have spent decades in clinical practice working with adults navigating the health changes that come with midlife and beyond. If you are over 50, this conversation is specifically for you, because the decade between 50 and 60 is when the habits, conditions, and medications that drive this problem quietly take hold. And the people who catch it early are the ones who avoid the consequences I'm about to describe. Most doctors spend less than 2 minutes discussing oral health at a typical annual physical. That silence has consequences. Today, I'm going to fill that gap. Here is what most people over 50 have never been told about their mouth. It runs on saliva, and saliva is not just moisture. It is a biological defense system. It is packed with antimicrobial proteins, enzymes that begin digestion, and compounds that continuously neutralize acid and rebuild your enamel. It controls which bacteria thrive in your mouth and which ones never survive long enough to cause damage. When that system is compromised, when saliva production drops, either overnight or throughout the day, the consequences are not limited to discomfort. They are measurable, documented, and in some cases, life-altering. Here is what nobody tells you. After 50, your risk for salivary dysfunction rises significantly, not because of age alone, but because of the combination of factors that accumulate in this decade. Medications, sleep changes, hydration habits, hormonal shifts, early-stage conditions that have not yet been diagnosed. Today, I am walking you through 7 things that are silently happening right now or soon when your mouth dries out, and for every single one, I will tell you what to do. Number 7, a bacterial colony is building in your mouth. Every night, most people assume nothing much happens in their mouth while they sleep. That assumption is one of the most costly ones I see adults make after 50. Here is what is actually happening inside your body. During waking hours, saliva flows steadily. Small, constant swallows sweep bacteria into your stomach, where acid destroys them. At night, salivary flow drops by up to 95%. That protective sweep essentially stops, and in that window, the bacteria in your mouth do not rest. They multiply rapidly, aggressively, without interruption. A study published in the Journal of Dental Research found that adults with reduced overnight salivary flow had dramatically elevated bacterial counts by morning, particularly the strains most associated with gum disease, tooth decay, and systemic inflammation. One of my patients, a 53-year-old woman who had excellent dental health her entire adult life, came to me after her dentist found 4 new cavities at a single appointment. She had not changed her brushing habits. What had changed was a new prescription added 6 months earlier and a pattern of waking up with a dry, sticky mouth she had been ignoring for just as long. Tonight's fix, before bed, rinse with half a teaspoon of salt dissolved in warm water for 45 seconds. This reduces overnight bacterial load, disrupts the environment harmful organisms thrive in, and costs nothing.
Make it a non-negotiable part of your routine. How long have you been waking up with a dry mouth? Drop a number in the comments, months or years. Number 6, your prescriptions may be quietly switching off your saliva. This one surprises almost everyone I tell it to. And I tell it to people every week. There are over 500 commonly prescribed medications that list dry mouth as a documented side effect. Blood pressure drugs, antihistamines, antidepressants, anti-anxiety medications, bladder control medications, diuretics, muscle relaxants, certain diabetes medications. The list is longer than most patients ever expect. Here is what happens inside your body. These drugs interfere with the nerve signals that instruct your salivary glands to produce. They reduce blood flow to gland tissue. They alter the composition of whatever saliva is still being made. Individually, the effect may be subtle, a slight reduction you barely notice. But after 50, the average adult is managing multiple prescriptions simultaneously. And those effects do not simply add up. They compound. They layer on top of each other in ways that no single prescribing physician, seeing you for one condition, is likely tracking as a unified picture. Think of your salivary glands as a factory. The order forms keep going missing. The supply deliveries keep arriving late. Half the workforce has been quietly reassigned. The building is still there, the machinery is still there, but output has dropped to a fraction of what it should be, and nobody sent you a memo. Research published in Gerodontology identified polypharmacy, the concurrent use of multiple medications, as one of the primary drivers of chronic dry mouth in adults over 50, and confirmed that most patients are never informed of this connection. Tonight's fix: write down every medication you currently take, prescription and over-the-counter. At your next physician visit, ask specifically, could any of these be reducing my saliva production? Ask whether alternatives exist or whether timing adjustments might help. This is a legitimate, answerable medical question. Push for an answer. Are you currently taking more than 2 prescription medications? Type yes below. Number 5. The way you breathe at night is drying out your mouth, and most people have no idea. You are designed to breathe through your nose while you sleep, not as a preference, as a biological necessity. Your nasal passages do something your mouth cannot. They filter incoming air, remove particles and pathogens, warm the air to body temperature, and humidify it before it reaches your airways. Your mouth bypasses all of that. It delivers dry, unfiltered, unconditioned air directly across every wet surface it passes. If you are mouth breathing during sleep because of congestion, allergies, a deviated septum, or undiagnosed obstructive sleep apnea, then for 7 or 8 hours every single night, a continuous current of dry air is moving across the interior of your mouth. Imagine a shallow dish of water left on a breezy windowsill for 8 hours. That is what is happening to your oral moisture. After 50, sleep apnea prevalence rises significantly. The airway changes in ways that increase the likelihood of nighttime obstruction. And people with undiagnosed apnea often mouth breathe as their body's compensation for a collapsing airway, waking dry, groggy, and unrefreshed, attributing it all to just getting older. A landmark study in sleep medicine found that adults with untreated obstructive sleep apnea had significantly higher rates of oral health deterioration compared to treated patients, with dry mouth being one of the earliest and most consistent symptoms. If you snore, if someone has noticed you stopping breathing at night, if you wake up tired no matter how long you sleep, please bring that to your doctor. The dry mouth is not the whole problem. It is the signal. Tonight's fix: a cool mist humidifier in your bedroom meaningfully reduces overnight drying by adding moisture to the air you breathe. It will not solve the underlying cause, but it reduces damage while you investigate. If you suspect mouth breathing or apnea, ask your physician for a sleep evaluation. The intervention changes everything. Before we go further, if you are finding this useful and you are the kind of person who wants to understand what is actually happening inside your body after 50, I want you to hit subscribe right now. I release a new video every week, not trends, not supplements, Real clinical information explained clearly, so you can make better decisions about your health. Hit the button, and then let's finish this list because numbers 2 and 1 are the ones that change everything. Number 4, dry mouth. After 50 creates a direct path to pneumonia. I want you to stop here because this is the consequence that I find most consistently underappreciated, even within medicine. Aspiration pneumonia is a pulmonary infection caused when material from the mouth, food, liquid, or saliva is inhaled into the lungs rather than swallowed correctly. Every time you swallow, a precisely coordinated sequence of muscular events takes place in under a second. Your epiglottis closes over your airway, your throat muscles contract in sequence. Material is directed cleanly into your esophagus. When saliva is insufficient, the material being swallowed becomes less cohesive. Less predictable, it breaks apart. Fragments separate from the main mass. That unpredictability is where the danger is. In younger adults, a powerful cough reflex catches material heading the wrong direction before it reaches the lungs. After 50, that reflex becomes measurably less sensitive. Swallowing coordination becomes subtly less precise. The safety margin shrinks. And when a droplet of contaminated saliva that has been sitting in a dry, bacterially overloaded oral environment all night, does make it into the lungs, the infection that follows can be severe and fast-moving. This is not a remote possibility. Aspiration pneumonia is among the leading causes of serious illness and hospitalization in adults over 55. And chronic dry mouth is a direct, modifiable risk factor sitting at the start of that chain. Tonight's fix: sip water before every meal to prime your salivary glands and lubricate the mouth before swallowing begins. Eat without distraction. Swallowing coordination requires attention. If you have noticed that swallowing has become something you consciously focus on, or if you cough frequently during meals, report that to your doctor. A swallowing evaluation is a real clinical tool. Use it. Did you know that dry mouth could be connected to pneumonia risk? Comment never knew or yes. Number 3, you could lose healthy teeth faster than you think. After 50, people generally believe their dental health is stable. They have kept their teeth this long. Routine checkups, routine cleanings. They know what they are doing. The assumption is that things will continue as they have. Dry mouth breaks that assumption completely. Here is what happens inside your body. Saliva remineralizes your enamel continuously. It buffers the acid that bacteria produce after every meal. It sweeps bacteria away before they can establish colonies at the gum line. When saliva is significantly reduced, acid sits against your enamel for extended periods without being neutralized. Enamel that was being quietly repaired every day is no longer being repaired. Bacteria that were being swept away accumulate undisturbed. The decay that results is not the slow, gradual kind that shows up at a checkup as an early lesion. It is faster. It often appears at the gum line and on root surfaces, locations that many people have never had a cavity before, and it can progress from early damage to deep infection in a time frame that catches people completely off guard. A study in the Journal of the American Dental Association found that adults with clinically significant dry mouth experience tooth loss at rates dramatically higher than age-matched peers with normal salivary function, with the most significant acceleration beginning in the decade after 50. Tonight's fix: use a fluoride toothpaste and brush for a full 2 minutes twice daily with a soft bristled brush. Add a tongue scraper every morning. The bacterial biofilm that forms overnight on your tongue feeds the cycle of decay. Ask your dentist specifically about prescription-strength fluoride if you have been experiencing dry mouth. It is available, effective, and underused. Number 2, your mouth may be silently raising your heart and brain risk. This is the connection most people have never heard, and the one that researchers have been documenting for years. When saliva is reduced, gum disease takes hold. The bacteria that colonize the space between your teeth and gums are normally held in check by saliva's antimicrobial properties. Without that protection, they multiply. triggering chronic inflammation in the gum tissue. That inflammation breaks down soft tissue. Eventually, it destroys the bone beneath. Gums recede, teeth destabilize. But here is what makes this systemic. Inflamed, bleeding gum tissue is not a sealed barrier. It is an open doorway. Bacteria from your mouth enter your bloodstream through those inflamed margins, and once in circulation, they travel. Research published in Circulation, the Journal of the American Heart Association, has linked specific oral pathogens to arterial plaque. The same bacteria found in diseased gums have been identified inside cardiovascular tissue. Chronic oral inflammation elevates the systemic inflammatory markers associated with heart attack and stroke risk. The brain connection is equally alarming. Oral pathogens have been found in the brain tissue of Alzheimer's patients at rates that have prompted serious, ongoing investigation into whether periodontal disease is a modifiable risk factor for cognitive decline. This is not fringe science. These are peer-reviewed findings being replicated at major research institutions. The starting point of this entire cascade is a mouth that is not properly protected. A mouth that dries out night after night while the person sleeping assumes it is just getting older. Tonight's fix: floss every night. This is the single most direct intervention for preventing the bacterial accumulation between teeth and gums that drives periodontal disease. If your gums bleed when you floss, that is not a reason to avoid it. It is a reason to be more consistent and schedule a gum health assessment promptly. Do you floss every night? Be honest. Yes, sometimes, or rarely. Number 1, your body has been sending you a signal, and most people ignore it for years. The most important thing I can tell you about dry mouth after 50 is not what it causes. It is what it means. Persistent morning dryness, the kind that returns night after night, that water alone does not fully resolve, that has slowly been getting worse, is not just a symptom, it is a message. Your body communicating consistently and clearly that something beneath the surface deserves attention. It may be signaling that your medications have crossed a threshold your salivary glands cannot compensate for. It may be telling you that your airway is compromised during sleep. It may be the first consistent external sign of Sjogren's syndrome. An autoimmune condition that attacks the moisture-producing glands is significantly more common in women in the years around menopause and goes undiagnosed for an average of 4 to 7 years. It may be connected to blood sugar regulation that has not yet shown up in a standard panel, to early neurological changes, to systemic inflammation that has not yet declared itself elsewhere. Every one of these, caught early after 50, before a decade of damage accumulates, is manageable. Left unaddressed, each one becomes significantly harder to reverse. A study published in The Lancet found that adults who received early clinical intervention for significant dry mouth had dramatically better outcomes at 3-year follow-up across oral health, swallowing safety, systemic inflammation markers, and quality of life compared to those who manage symptoms on their own. I had a patient, 54 years old, healthy by every external measure, who mentioned dry mouth to her physician twice in 3 years and was told to drink more water. At her 4th visit, a different physician ordered a full salivary assessment. The results led to an autoimmune workup. She was diagnosed with Sjogren's syndrome. Treatment began. The deterioration that was quietly progressing stopped. She told me she wished she had pushed harder, sooner. I wished her earlier doctors had listened harder. Tonight's fix: make 2 appointments. One with your dentist, ask specifically for a salivary function assessment, gum health evaluation, and early decay screening. One with your physician, bring a written list of every medication you take, describe your sleep patterns, and state clearly how long this has been happening. Do not minimize it. Dry mouth is a clinical symptom. Bring it to the front of the conversation, not the end. Have you ever mentioned dry mouth to a doctor and felt it was brushed off? Type yes. I want to hear from you. Here is your complete daily protocol. The science is solid. The time investment is under 10 minutes across the entire day. Morning, first 5 minutes after waking. Drink 8 ahs of water before anything else. Scrape your tongue from back to front, 5-7 strokes to clear the overnight bacterial film. Brush with fluoride toothpaste for 2 full minutes using a soft brush. Chew 2 pieces of xylitol gum for 10 minutes. This actively stimulates salivary glands and suppresses harmful bacteria simultaneously. Throughout the day, sip water consistently in small amounts. Do not wait for thirst to tell you to drink, especially after 50 when the thirst mechanism becomes measurably less reliable. Keep a bottle visible as a prompt. Eat 1 serving of crunchy, fibrous food, apple, carrot, celery, which mechanically stimulates gland activity. Moderate alcohol, caffeine, and heavily salted or acidic foods which each contribute to dryness. Evening. Avoid alcohol within 3 hours of sleep. Floss. Saltwater rinse for 45 seconds. Run a cool mist humidifier. Sip water immediately before turning off the light. Adults who consistently follow structured salivary hygiene protocols reduce their aspiration pneumonia risk by up to 40% and dramatically slow the progression of dry mouth-related dental decay. You can start this tonight, not next week, tonight. 7 things, each manageable on its own. Together they form a chain that moves from your mouth to your lungs, your teeth, your gums, your bloodstream, your heart, and your brain. Overnight bacterial overgrowth, medication-driven gland suppression, nighttime mouth breathing, aspiration risk at every meal, accelerating dental decay, a bloodstream pathway to cardiovascular and cognitive disease, and a signal your body has been sending for months or years, waiting for you to listen. This is not inevitable. This is not just aging. This is preventable. And the earlier after 50 you act, the more you protect. Your mouth has been working for you quietly, without recognition, for 5 decades or more. Every conversation, every meal, every morning you have woken up and moved through your day, it has been protecting you without ever asking for anything in return. Tonight, give it something back. Drink your water, scrape your tongue, floss, sip before you sleep. And tomorrow morning, when you reach for that glass of water and feel the dryness, remember, that is not just discomfort. That is your body talking to you. Now you know how to listen. You just stayed through the full list. And that tells me you are someone who takes this seriously. So I want to make sure you actually have what you need to act on it. If this gave you something real today, a name for something you have been experiencing, a reason to finally make that appointment, a connection you had never been told about, then subscribe. Every week I share health information that matters, explained clearly for adults over 50 who are ready to take their health seriously. Hit the subscribe button and the bell so you never miss a video that might change how you see your own body. Hit like on this video. It costs you nothing, and it helps this message reach someone else who may need it just as much as you did. And right now in the comments, I want you to write one thing. I am paying attention. 3 words, that is all. It means you heard this. It means you are going to do something with it. Then share this with someone you love, a partner, a sibling, a friend who has mentioned a dry mouth and laughed it off. You may never know whose life you just changed. I am Dr. Ethan Reed. Take care of your mouth, and it will take care of you. I will see you in the next video.